call this meeting to order. Welcome to meeting number 17 of the House of Commons Standing Committee on Industry, Science and Technology. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021. The proceedings will be available via the House of Commons website. So you are aware the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I'd like to outline a few rules to follow. Members and witnesses may speak in the official language of your choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either Floor, English, or French. For members participating in person, proceed as you usually would when the whole committee is meeting in person in a committee room. Keep in mind the directives from the Board of Internal Economy regarding masking and health protocols. Before speaking, please wait until I recognize you by name. If you are on video conference, please click on the microphone icon to unmute yourself. For those in the room, your microphone will be controlled as normal by the proceeding and verification officer. A reminder to all that comments by members and witnesses should be addressed through the chair. When you are not speaking, I ask that you keep your microphone off. With regard to the speaking list, the committee clerk and I will do our best so that we can maintain the order of speaking for all members, whether you are participating virtually or in person. For those who are joining us for the first time, as is my normal practice, I will hold up a yellow card for when you have 30 seconds remaining in your intervention and a red card for when your time for questions has expired. As we have a very full agenda today, I ask that you respect those timelines so that every member has a chance to have their questions asked. Pursuant to Standing Order 1082 and the motion adopted by the committee on Tuesday, December 1st, 2020, the committee is meeting today to continue its study on the domestic manufacturing capacity for a COVID-19 vaccine. I'd now like to welcome our witnesses. Today, from Providence Therapeutics, we have Ken Hughes, Chair of the Board, and Brad Sorensen, Chief Executive Officer. From Vido Intervac, Volker Gertz, Director and Chief Executive Officer. From Biotech Canada, Andrew Casey, President and CEO. And as individuals, Professor Amir Adaran from University of Ottawa, Professor Joel Lexchin from the Department of Family and Community Medicine Emergency Medicine Division, and Professor Alain Lamarre. Each witness will present for 5 minutes, followed by rounds of questions. With that, I will start with Providence Therapeutics. You have the floor for 5 minutes.
Thank you, Chair of the committee and members, and thank you for the opportunity to join you today. As the former chair of the Aboriginal Affairs Committee of this House of Commons, I acknowledge with respect that we live on the traditional lands of Indigenous peoples from sea to sea to sea. My name is Ken Hughes, and I have served as chair of the board of Providence Therapeutics for about 4 years. As a country, we are not yet where we want to be in protecting Canadians from this pandemic. Yet Canada has exceptional public and private sector scientific, medical, and business expertise among the very best in the world. Unfortunately, we have not marshaled that capacity effectively. Never again should we have to rely upon other countries for vaccines or the science behind them. Providence can have millions of doses of messenger RNA vaccine by this fall, the goal being October. We're on that path now, having recruited leading development and manufacturing expertise. Last summer, decisions were made to buy large orders of vaccines from outside of Canada. The received wisdom was that we did not have the capacity to do that in Canada. Unfortunately, at that time, people focused only on the supply of vaccines for Canada for the pandemic as we all knew it then. There was little focus on how we prepare ourselves for a world beyond the immediate pandemic. Let's not make that mistake again. Now things have changed. First, emerging variants may enable coronavirus to stay with us for the foreseeable future. Second, messenger RNA has been validated as an agile, highly effective, and responsive vaccine platform. There are other Canadian vaccine teams who can contribute as well. Canadians can develop vaccines and manufacture them here. We can even blunt emerging variants of the virus. We can do it, but we won't do it just by inviting in branch plants of foreign companies. We do it by building up the domestic talent we have here already. As America's closest neighbor, we have learned never to bet against America when they put their minds to something. They put their minds and billions of dollars behind Operation Warp Speed, and amongst other things, validated the messenger RNA platform for vaccines. In the future, I would like the world to look at Canada and say, you know, those Canadians, never bet against them. That could be our future. We're here today to specifically ask the Canadian government to invest in Canadian capacity and help realize that future. Thank you. I'm pleased to turn it over to Brad Sorensen, CEO and founder of Providence Therapeutics.
Messenger RNA is the most effective vaccine technology on the planet. In the worldwide race for a COVID vaccine, messenger RNA was the fastest by months. It was the most effective at 95% efficacy. It will be the fastest to respond to the variants that are emerging now. It is the most scalable vaccine technology, having gone from novel technology to rolling out hundreds of millions of doses within 6 months. The committee will recall that prior to November 2020, no mRNA drug, vaccine or otherwise, had ever been approved for use in humans. In fact, prior to 2020, Moderna and BioNTech, the inventor of the Pfizer vaccine, had never even run a phase 3 trial. Yet these untested and unproven companies are now Canada's lifeline to safety and economic stability. In 2020, Providence designed a vaccine in under 4 weeks. We negotiated and paid for license to the necessary intellectual property. We established productive collaborations with other companies across Canada. We completed over 5 preclinical animal trials to establish the safety and efficacy of our vaccine. We qualified a good manufacturing practices, or GMP, manufacturing process and manufactured enough vaccine to complete all of our clinical trials. We prepared a successful clinical trial application, and we were given the green light known as authorization by Health Canada to proceed in phase 1 trials. In 2021, Providence will manufacture and sell vaccines directly to Canada's provinces. It will build out manufacturing capacity covering the entire value chain of messenger RNA vaccine production, from the earliest raw material to the final formulation and fill finish. It will complete the clinical trial process with Health Canada and secure all the necessary approvals to enable the provinces to administer those vaccines to Canadians. Providence will accelerate its work on booster doses for variants and bring its second generation vaccine using both B and T cell mediated immune protection into the clinic. In short, Providence will do all that is necessary to ensure Canadians have the earliest access to the best vaccines. Look forward to your questions.
Thank you very much. Our next witness is Mr. Gertz. You have the floor for 5 minutes.
Well, good morning, Madam Chair. Good morning, members of the committee. Thank you for giving me the opportunity to address you this morning. My name is Volker Gertz. I'm the Director and CEO of VIDO, the Vaccine and Infectious Disease Organization here at the University of Saskatchewan. For those of you that may not be familiar with us, we're a research center here at the university, and we really, during this response to the pandemic, have become one of Canada's go-to places for COVID-19 research. We were the first in the country to isolate the virus, the first in the country to establish an animal model that is then being used to test vaccines and antivirals and so on. And since the beginning of last year, have now worked with more than 80 companies, including half of them Canadian companies, on identifying vaccine, therapeutics, and antivirals. We also have our own vaccine in the making. We were also able to design this vaccine and have it in the lab produced, ready for immunization within 4 weeks. We were one of the first in the world to have this vaccine in animals. And over the last year, similar to what you just heard, also completed the necessary animal trials to get approval from Health Canada. And our vaccine is now also in phase 1 trials. Our vaccine is a protein subunit vaccine, which is a well-known technology that has been in humans for many, many years and offers many advantages in that it's actually more stable, easier to store, easier to transport. And because of the adjuvant that we're mixing with it, gives a very broad immune response, which is great for these variants. What we're also doing here at VIDO right now is building a manufacturing facility. And this manufacturing facility is currently underway. It's a 10,000 square foot facility. It's what's called a pilot scale manufacturing facility. and it will enable us to produce both human and animal vaccines here at Vito Intervac. It is also unique in that it is tied into our biocontainment facility that we operate here at Vito, Canada's largest high containment laboratory, and thus will enable us to work on vaccines for emerging diseases as they emerge. Construction is currently underway. By October, this facility will be completed, and then there will be a phase of GMP certification, commissioning of the facility, and so on. And by next year, our facility will be ready to produce vaccines here in Canada. What we also have put forward is a proposal to the federal government, which with support from the provincial government as well, hopefully also from private donors and the municipal government, for Vito really to become Canada's Centre for Pandemic Research. We have currently the largest infrastructure for high containment research right here in Saskatoon, which is based on previous investments by governments. That includes Canada's largest high containment laboratory, the International Vaccine Centre. We're building now an in-house GMP manufacturing facility. And what we think is needed to really become one of those centers that can help the country in better preparing for the next emerging disease is having an animal facility that allows us to work with a wide range of animals, including bats, insects, ticks, reptiles, and so on. And that's a proposal that we put forward. But if we wanted to be, as a country, self-reliant, self-sufficient on domestic manufacturing and research capacity, we think that it is necessary to have these national centers that are specifically focused on emerging diseases. Thank you.
Thank you very much. We now turn to Mr. Casey. You have the floor for 5 minutes.
Merci, Madame la Présidente. Good morning, and thank you very much for this important and obviously very timely opportunity to provide some perspectives from Biotech Canada. By way of introduction, Biotech Canada is the national association representing Canada's biotech sector. Our members are 240 plus. They are across the country in every single city and province. They include all the small early stage companies that are developing new solutions for the world. Some of the companies you've heard during the COVID crisis, including Accelera, Precision Nanosystems, Medicago, Vito Intervac, all emerging technologies. But our membership also includes the large multinational pharmaceutical companies that are developing the vaccines. So the big brand names that everybody's become familiar with over the past several months. Both of those groups come together and present the Biotech Canada voice. And what we sort of talk a bit about is a world that's moving to 10 billion people and the types of solutions that biotechnology represents and sort of getting us out of some of the problems and challenges that we face as a global society. I think that the COVID crisis has greatly underlined just how critical these types of solutions are going to be for society, obviously now, but and then going forward. If you think back to just a little over a year ago when the first case was diagnosed in Canada, it was hard to imagine then that we would be where we are right now. It was very difficult to sort of foresee where this was going to go. We have now the benefit of some hindsight and some opportunity to plan going forward. I think the government did some very strategically smart things in terms of looking at the technologies that were out there, investing in some of the Canadian technologies and trying to advance them a little bit more quickly than they would have normally advanced, as Volker just enunciated, but also looking out and seeing which of the vaccine technologies showed the greatest promise for delivering some solutions in the immediate future. We now sit in a situation where the vaccines are going into arms of Canadians. More vaccines are going to come online. I think it's an important time to sort of take some stock, learn some lessons. We've been through this a little bit before in other crises like SARS. There were warning signs. We were all told we should prepare for a pandemic. I think we have to prepare for COVID-30. You pick your year, you pick your virus. There's going to be another challenge like this. And what are we going to do to prepare for that so that we're not back in the situation where sort of cobbling together a solution? And I think Canada has an enormous opportunity to build on its biotech ecosystem, the solutions that are coming out of the industry, but also the international players that are here and present in this country, which are a big part of the economic or big part of the solution as well in terms of as partners and investors in this country. I think a strategy that would bring all of that together, build on the collaboration that's existed to this date, would be a wise thing to do. And certainly as we think about going forward, it's something we should plan for. Thank you.
Thank you very much. We now go to Professor Atran. You have the floor for 5 minutes.
Thank you. I'm Professor Amir Ataran. By way of background, I'm a scientist. My PhD is in cell biology and immunology from Oxford. I'm a lawyer, and I've worked in the pharmaceutical industry, including on a project where we had to increase production 6,000% in 1 year. So I feel the pain of those in industry who have to step up to this right now. I want to talk about what's brought us to this point. And I'm going to list 8 things. The first is that Canada was slow when competition for vaccine purchases and partnerships was intense last spring and summer. We were weeks or months slower off the mark than peer countries. Who's ever heard of the last mover advantage? It doesn't exist. The second point is we did not manufacture the only vaccine that we could have done, which is the Oxford AstraZeneca one, and which was available to us and other countries under a license. Since that time, the Prime Minister has oddly blamed this on Brian Mulroney. That isn't really true because a careful study shows that Britain itself did not have as much vaccine manufacturing capacity at the beginning of 2020 as Canada did. Canada had more. They stepped on it. They built capacity in months. They are now nearly the best in the world at vaccination. We are around 40th place. And that's a big problem. I mean, every day the British vaccinate a huge number of people that we don't. The Americans vaccinate more people every day than Canada has in the last 2 months combined. Compared to those countries, our vaccine task force is shockingly secretive. My third point, as late as July last year, the government would not even release the names of the participants on the vaccine task force, much less the work plan, much less the minutes of their meetings, which are still secret. And we now see the result of that. Unfortunately, the co-chair, Dr. Joanne Langley, is now embarking on a media tour to rewrite history and say that the task force did a good job. It patently didn't, given where we are today. Fourth, our government put the wrong ministry in charge. Every single successful country at this, the United States, the United Kingdom, Israel, Chile, they put the health ministry in the lead. But in Canada, vaccines have been led by the industry ministry and procurement, as if we are building a bridge or procuring toilet paper, which is not the case. The health ministry in Canada is conspicuous by its absence. And 5, when all this was realized, Anita Anand, apparently with PMO approval, ran around in agitated anguish trying to sign any vaccine deals she could. We've signed more than any other country in the world. Yet some of the deals we've signed are with companies that can't deliver in 2021. Some of them won't be able to deliver in 2022. Some of them, and we've heard from one this morning, perhaps will never deliver. It seems as in panic, what we did was become less strategic rather than more. 6, much of this institutional failure I've outlined is because Canada's science establishment, and I underscore this, is plain inferior to our peer countries. We have no Tony Fauci, not even close. On the contrary, the Prime Minister's chief science advisor, Dr. Mona Nemer, has issued 3 statements, precisely 3 since coming into the office years ago. 2 of the 3 are an election financing in Canada Day. That's not science. She has, with the help of outside committees during COVID, issued 3 fairly low quality reports on COVID science, 3 reports. In contrast, little Switzerland has issued over 70 reports from its vaccine task, or pardon me, its COVID task force. 7th, these indications of disaster were just not heeded. I mean, journalists have been writing about this for a long time. I wrote a desperate warning last August in Maclean's that we were heading for vaccine failure, and that was quite ignored, as were the journalist warnings. I even personally wrote to the Prime Minister's office in August. There was no dialogue set up with that until November. So we have an insular government as well that is hurting us here. And finally, my last point, you know, even today, I'm not confident that good ideas are being heard. And that's critical to our security, and I'll explain why in questions. Thank you very much.
Thank you very much, Professor Adaran. We now go to Professor Lection. You have the floor for 5 minutes.
Thank you very much, Madam Chairman. My name, and thanks to the committee for inviting me to speak. My name is Joel Lection. I'm an emergency physician in downtown Toronto. I've been one for the past 39 years, and I taught health policy for 15 years at York University. A lot of the points that I'm going to make have been made in one form or another already, so I'll just emphasize a few. One of them is that when we came into the COVID pandemic, we lacked any manufacturing capability, and this was partly because of the sale of Connaught to Mérieux, now part of Sanofi in the late 1980s, and then the sale of Biochem Pharma, which was based in Quebec in 2006 to GlaxoSmithKline. And while Sanofi and GlaxoSmithKline continue to make vaccines here in Canada, they have decided not to make the COVID vaccine that they are jointly working on in Canada. So although they have plants here, they are not going to utilize them to make the vaccine if and when it gets approved. We also had warnings about the need for a vaccine policy and domestic vaccine manufacturing. This came about through SARS in 2003. After SARS, David Naylor wrote a report emphasizing the need for a vaccine strategy and for a secure supply of vaccine. We seem to ignore that. We had the H1N1 pandemic in 2009. The vaccine production in the Quebec, in the plant in Saint-Foy was delayed. We seem to ignore that. And then we had Ebola in 2014. Fortunately, it didn't arrive in Canada, but we ignored that too. So we come to early 2020, we've ignored warnings, and we don't have any domestic capability and the domestic for to make a COVID vaccine. As a result, we ended up relying on a number of foreign-based companies manufacturing vaccine outside of Canada, and we've seen currently what the results of that have been with Pfizer's delays and Moderna delays. So in view of that, I offer 4 recommendations to the committee. So the first one is that we need to develop a national vaccine strategy that will consist of strong and enduring financial commitment to publicly funded and publicly run vaccine research. This has, as I said, this has been recommended before and largely ignored. Second, we need to invest in a domestic, publicly owned vaccine manufacturing facility so we can avoid the situation of a privately owned Canadian company being sold to foreign interests at some time in the future, and therefore removing control from Canadian hands. And that's what we've got with the situation with Sanofi and GlaxoSmithKline. Based in manufacturing facilities based in Canada, decisions made outside of Canada, and decision not to manufacture their vaccine here in this country. Third, if we can't guarantee domestic vaccine production, Canada should issue compulsory licenses to increase vaccine production. And finally, in the future, if we're going to grant money for vaccine research and manufacturing to private companies or sign contracts for vaccines with private companies, we need to make those deals publicly known with the details so that we can understand what's happening and what's not happening in the country. Thank you very much.
Thank you very much, Professor. Notre prochain tour, c'est
Our next speaker will be Professor Lamar. You have 5 minutes. Thank you very much, Chair. First of all, I'd like to thank the committee for inviting me to speak today. This is something that concerns me very much. It's very important for the country as well. And it's important for us to better prepare for future pandemics. This is a subject that I'm personally interested in because I've been involved in all levels of vaccine preparation during my career, from concept to trials. And I'm a professor at the Armand Frappier Health and Biotechnology Institute on the campus of the former Armand Frappier Institute. Dr. Armand Frappier was a pioneer of public health in Canada and in Quebec. He participated in the development and the production of many vaccines. At the time, Canada was a world leader in vaccine production, but its production capacity diminished with the globalization of this industry. Canada's small market share internationally also contributed to the exodus of vaccine manufacturers in the 1980s. So we now have a national vaccine capacity which is insufficient for our needs and which leaves us to the mercy of vaccine protectionism. As you can see now, Canada has begun to make investments, big investments, to reestablish its national vaccine capacity. But more must be done in the coming years to rebuild a rich and diverse ecosystem at all levels of the vaccine development chain, with a view to contributing to reflection on these strategic issues. I would like to outline 3 areas that Canada must concentrate on to invest in the future benefits of vaccine production. First, continue and increase federal investment in basic research in Canada. Basic research is an indispensable part of the development of new technologies linked to vaccination. For example, the messenger RNA technology, which is at the base of new vaccines like the Pfizer-BioNTech and Moderna vaccines, is a result of developments in the development of new approaches for treatment of cancer. That means that innovative approaches aren't always accelerated by targeted and specific investments, but are based on investments in basic research that the results of which are not always identified at first. Although these amounts from the government have increased over the years, the growing demand for funding and the increased costs mean that the success rate for getting subsidies for research has dropped greatly over recent years, making it difficult for university laboratories to survive. It's important to increase subsidies for research to maintain our place in the world. Secondly, increase and continue federal investment in research infrastructure, leading-edge research through the Canadian Innovation Fund. The new advances in basic research, in particular for the development of vaccines, infrastructure, leading-edge technology, the Canadian Innovation Fund has put Canada in an enviable position. On the other hand, these new infrastructures have high costs and require regular maintenance for researchers and universities. So it's essential that these investments go not only to infrastructure, but also into the long-term operational costs and maintenance. And third, we have to have a financing structure for ensuring the interface between academic research and the pharmaceutical industry for the development of vaccines. Canada already has world leaders in vaccine development in its universities. These researchers conceive and develop new approaches that are innovative, diverse, but the costs associated with this work are too much for small biotechnical companies to assume. So many vaccine candidates that could be promising, developed in universities, never get to market. Government investment would allow for the development of clinical candidates that would be advanced and mature enough to draw the attention of major pharmaceutical companies for investment and production. So the presence of such accelerators for vaccine development in Canada could encourage major pharmaceutical companies to build factories for vaccines near the research facilities and complete the production chain. As a professor at the Quebec's Health Institute, I'm ready to work with my students in such efforts. And to conclude, it's not too late for Canada to better position itself for vaccine production and to be better placed to fight COVID-19 and future pandemics. Thank you. Thank you very much, Professor.
Questions. And our first round of questions goes to Député Police. Vous avez la parole pour 6 minutes.
Merci, Madame la Présidente.
Thank you very much, Chair. Thank you very much for your presentations. Day after day, we have the impression that the current government was incompetent and counted on improvisation. And I would like to ask the representative of Providence and also Mr. Lamar. And what does your sector think about the possible failings of the government? What are the failings that have come to light in our system, and what is the effect on the situation now?
I would not say that this is a failing of one government. This is the failing of Canada and our ability to focus and develop strategic capacity over many governments. It's easy to point fingers, but as kids, we all learn that when you point a finger, you've got 3 fingers pointing right back at you.
Mr.
And,
Hughes, would you be able to move your microphone a little
I'm sorry.
closer?
Yes.
Please? Thank you.
Thank you. Sorry. We all know that it doesn't take us anywhere to sort of worry about how we got here. We got here because of people were not completely informed. We got here because of mistakes in judgment. But in my experience, people in public life have good intent and try to do their very best with the information they have. If we look back over how we got here over the last several decades, we haven't invested enough. We haven't used our strategic capacity to figure out what we really need and don't need in preparing for a crisis like the one that we have. And this was, not a complete surprise. People like Bill Gates made it quite clear.
Merci.
People were listening.
Thank you, sir. Merci. Mais j'aimerais savoir.
Thank you very much. But perhaps, Mr. Sorensen, when you heard Minister Anand, as we heard the Journal de Montréal said to create a new factory, we have to have expertise and we have to have the resources. And Ms. Anand said that in Canada we don't have experts and expertise for vaccine production. What is your reaction?
Have the production to make all of the different vaccine technologies that are being pursued with regards to across the entire platform? No, we don't. And we have production in Canada that's committed to other essential vaccines that still need to be produced. COVID isn't the only problem across the world. My only complaint isn't necessarily with the work of the task force or the government in casting a very broad net early on. My frustration is that as data rolled in, as we saw technologies that were effective, and I didn't see any adaptation to that additional knowledge. And so that is, again, I agree with my colleague Ken Hughes that, it's not about pointing fingers. I mean, no government had the experience of dealing with pandemic prior to this. But the question is what are we going to do with the information that we have now, and how are we going to apply that information on a go-forward basis?
Merci, Mr. Sorensen.
Thank you very much, Mr. Sorensen. And that leads me to the next question I would like to ask Professor Ataran. When we talk about disconnection, the ministers, the cabinet, and we have an example. I have in my hands an exchange of messages, emails from Minister Anand and Honeywell, and in 2020, and the various emails from political staff saying, "Oh, we don't have to do this or do that. It's not necessary." Is this a general problem with regard to the evaluation of the situation? The employees, the ministries, ministers, or did they not have enough information, and was there disinformation? And did they take bad decisions, like today, for example, deciding to work with Cancino? And that was the worst idea of the century, I would think. And then ignore companies like Honeywell or others. Do you have any ideas in that regard?
C'est que ici, chez nous, au Canada, on manque l'expertise scientifique au sein du gouvernement. C'est ça.
The problem is here that in Canada we do not have the expertise required. We are not as educated as other countries are, other federal institutions are, for example, in the United States or in England.
I am trained in the United States. I did my graduate work in the United Kingdom. I worked in Europe at a pharmaceutical firm. Then I came to Canada, and I love Canada. It's where I've chosen to raise a family, but it is simply the least scientifically competent country I've ever come across. And that is a much larger discussion, perhaps not for today, but it is one on which our lives depend. Why are we as a government so institutionally weak on science?
Merci. Merci beaucoup.
Thank you very much. Our next round of questions goes to MP Assassi. You have the floor for 6 minutes.
Thank you, Madam Chair, and thank you to all the witnesses for appearing before committee. Now, if I could commence by asking Mr. Casey. As you know, Mr. Casey, since the early days of COVID-19, the government was focused on a three-pronged approach, which was to try to secure leading international vaccines. Number two, to invest in the most promising Canadian manufacturers of therapeutics and vaccines. And thirdly, to develop biomanufacturing capacity. Now, central to that strategy was the establishment of a vaccine task force. Could you share with us what your opinion of the vaccine task force is? After all, these are leading scientists and industry experts that sit on that committee, and they've been doing their due diligence. So could you tell us whether that was an effective approach or not?
Well, thank you, Mr. Assassi, for the question. I do. I actually think it was a very strong approach. I think the government recognized early on that this was going to be a very fast-moving space, that it did not have the expertise and the depth to quickly sort of identify where the really promising technologies were going to be, but then understood very well that they had to move quickly. And so I think if I look at that task force, both for the vaccines, but also for the therapeutic task force, if you recall back in the early days, some of the main focus was actually thinking that therapeutics were going to be the first things that would help us, and it would be vaccines that would come later, maybe 3 to 5 years later. The therapeutics was actually one of the first steps that they moved into. And on both, they put together panels of experts that spreads across a fairly wide and diverse areas of expertise. I think that was the prudent thing to do. I think you get not only expertise from a number of different key communities, but you also get the connections that a lot of those individuals bring to the table, particularly when you're dealing in a global context, the ability to reach out to other parts of the world and to other companies and sort of connect and understand where things are moving and where the puck is going. I think that was absolutely critical.
And to the extent that they had to review data from over 300 vaccine manufacturers, and they ultimately settled on 7 as perhaps being the most promising. How do you think they did with respect to the 7 which were identified as companies that Canada should attempt to enter into contracts with? Was that a good bet?
It sure seems to be. I mean, you look at how many were out there, how many potential candidates were out there, the new types of technologies. And if I understand that the contracts that we signed are with the 7 that show the greatest promise, not the least of which are the Pfizer and Moderna vaccines. Coming shortly thereafter is going to be the AstraZeneca vaccine, Novavax. Those are all identified by the group. So I think figuring that part out was absolutely critical.
Thank you. Now, if I could go to Mr. Lekshine, you obviously come at this with many, many years of experience. You touched upon how there was an exodus from Canada vaccine manufacturers starting in 2007, which was AstraZeneca, then 2010, Johnson & Johnson, 2011, Teva, and 2013, Behringer. It's also important to bear in mind that the previous government did not understand the significance of investing in life sciences. So how critical were these developments in terms of hollowing out our capacity to develop vaccines here at home in Canada?
Thanks very much for the question. I don't think that it was just the Conservative government that is to blame for this. When the Chrétien government came into power in, I think, 1993, they did not engage in any investment. The government seemed to ignore the recommendations of the Naylor report, which was commissioned in 2003 after SARS. And in fact, the Harper didn't do anything, neither did Trudeau. And in fact, they let the PHAC early warning system deteriorate such that we were taken more or less by surprise by the pandemic. So I don't think that we can blame this on any one government. I think that it's been a failure to look at things in a future sense and take action.
Excellent. Thank you. Now, if I could follow up with the same question I asked Mr. Casey. If you could provide your insights with respect to the vaccine task force and how crucial and critical they have been to our overall effort as a country, how would you rate them?
I think that the problem with the vaccine task force, there are a number of them. So as Professor Attaran pointed out, the names of the people were kept secret. The conflicts of interest were kept secret. The advice that they've given to the government has been kept secret. There aren't any minutes of the meetings that are being given. So we don't know if the advice that they were giving was influenced by the conflicts of interest on the committee.
Unfortunately, that's all your time, MP Assassi. Notre prochain tour, c'est député Lemire.
Mr. Lemire, you have the floor now. You have 6 minutes. Thank you, Madam Chair, and thank you to the witnesses for their presentations. My question is for Mr. Lamarre. You raised several issues in your speech. What actions can we take in our pharmaceutical system from basic research to manufacturing in order to ensure success? Thank you for the question, Mr. Lemire. I think what the other witnesses have said is telling. They have said that the complete ecosystem in Canada is just defective. We must reinvest at every level of the entire ecosystem of vaccine development from the very start, from basic research on. So we need to invest from the ground up to ensure that new technologies can emerge and will be supported in their maturing to their to their use and commercialization. We also have to invest in infrastructure and technology And we also have to develop our capacity in terms of clinical testing and manufacturing to ensure that any technologies that are developed by our universities can mature, can turn into biotechnologies, and can be sold commercially. In your speech, you said that the government has to invest in order to optimize the repercussions and the benefits of vaccine production. What are these benefits? Well, I think we'd be in a much more, one of the benefits is that we'd be in a much more comfortable situation than we have now. In the current situation, we are at the mercy of foreign partners that can decide overnight to sell internally as opposed to exporting. So it would give us a lot more independence, self-reliance, and internal capacity. It would allow us to have a domestic capacity and to keep our researchers in Canada, avoiding brain drain to other countries. It would also allow us to create employment here in Canada, good jobs here in Canada. So there would be many benefits to this strategy. Yes, but we can see that in the current situation, Canada is experiencing delays in its supply, but perhaps because it has been constantly missing the boat over the last 20 years. And now we see the result. Our pharmaceutical capacity is just not up to date and is unable to meet demand. And we are now relying on other countries. Is that what you've just said? Yes, that's exactly it. All right. So now the government seems to have a new drive, new will. When Mr. Champagne said that we would rebuild bio manufacturing and reinvest in research, now that has its own set of problems. What are some of the problems with that? Well, we must avoid putting all our eggs in the same basket. We must avoid betting on one single technology or one single manufacturer. We need a very diversified vaccine production sector that is based that we need to support lots of different technologies, because the technology that is working today might not work in 10 years. We might need a different technology in 10 years, which means that, yes, we must invest, but we must invest on every level and in every sector in order to provide ourselves with a certain flexibility to meet the next pandemic. We also know that the pharmaceutical industry was a source of pride in Quebec and Canada up until 2000, when the Martin government invested in this sector, but then the Conservatives de-invested in this sector. Do you think the government should reinvest in this sector in order to provide the pharmaceutical sector with predictability? Yes, that is certainly one thing they could do. That would be a good thing, but it's not the only thing they could do. I think the most important thing for the pharmaceutical industry to choose a country over another is the overall research ecosystem. They need to see that the whole ecosystem is strong in terms of equipment, in terms of ideas, in terms of know-how and workers. You need to invest in the whole ecosystem, just not one aspect of it, in order to rebuild a strong ecosystem and then attract pharmaceutical companies and their investment. But this ecosystem, of course, includes infrastructure. How important is investing in infrastructure for the development of new technologies and clinical trials? Well, the vaccine development industry is unique, and biologics, too, could be included in this sector. It's unique because it's extraordinarily expensive. So scaling up technology is extremely costly. You have to follow the best manufacturing practices very scrupulously, and you have to have enough product to test it in clinical trials, and those clinical trials are very expensive in their own right. And you have to also have the facilities for immunomonitoring. All this is very expensive, and Canada will have to invest massively in all these aspects. Thank you, Mr. Lamar.
MP Massé, you have the floor for 6 minutes.
Thank you, Madam Chair, and thank you to our witnesses. Mr. Lexon, my first question will be for you. I come from a manufacturing base in Windsor, Ontario, and we remember during the election when Prime Minister Trudeau said that we needed a transition out of manufacturing. We had a collective gasp down here because we've been fighting for our auto industry, and meanwhile, across the river in Detroit, they've put $16 billion into auto in the platinum age, is what I call it, because it's actually new electrification and so forth, and we're slowly catching up where we only have a few $billion across our entire country. Our tool and die mold making industry almost went bankrupt, but we transitioned into aerospace from auto, and we keep auto and also medical devices. My question specifically to you is, do you think that there still is a capacity in our country to build a manufacturing facility as you have advocated for? Because I see it plain and simple down here that we can do this still. We switched to PPE for Ford and Hiram Walkers for as well, distillery. But we have to have the political will to do so.
Thanks very much for the question. So I think that there is a capacity in Canada to build a publicly owned manufacturing facility. As people have pointed out, there are multiple different technologies to make vaccines. I don't think that we can invest in all of them. And that's why I think that we also need to invest heavily into research and development in vaccine technology and more broadly in medical technology so that we can look into the future, see what the emerging techniques are for making vaccines, and if necessary, use that to change the production capabilities of any publicly owned plant. Right now in Canada, CIHR invests about $1 billion a year in medical research. Compare that to what happens in the United States, 10 times the population, but the NIH invests $40 billion, so 4 times as much per capita as Canada does. And I think we need to go a long way to correct that imbalance.
Okay, thank you very much. And Mr. Attaran, I want to come to what your testimony had with regards to Britain and what they did. And there seems to be somewhat of a disconnect. It's an unfortunate one with our scientific community. It seems that we don't have the bridge necessary or the confidence in the structural components of the scientific community to move it towards manufacturing. But maybe perhaps you can reflect on what they did different and better there, because they also had a decline in manufacturing, but they've reclimbed that ladder.
Which proves that Canada could have done it last year and Canada failed. So I'll just quote from a report by the British biotech industry advocate. Similar to Biotech Canada, Mr. Casey will know, Britain has an organization very similar to his. Last year, they wrote, quote, the UK has limited or no vaccine manufacturing capability, close quote. And what did they mean by that? They meant that the UK had only the capacity of 200 liters of cell culture growth capacity to make the Oxford AstraZeneca vaccine. 200 liters isn't a lot. But at the end of 2019, the National Research Council had 500 liters capacity. We had more capacity in this country going into COVID than the British did. Yet the British stepped up. They made use of their limited capacity in 2020. They really expanded it quickly. That's what their vaccine task force did that ours failed to do. And now look where they are. They're manufacturing and soon they'll be exporting. That was done in 1 year, and it's able to be done because there are single-use bioreactor technologies out of there around the world that Canada just hasn't adopted. We blew it. And our vaccine task force blew it in not doing that. I want to add one last thing to this answer. At the end of 2019, when COVID hit, there was only one facility in the world that had ever made an adenovirus-based vaccine and commercialized it. That's the technology used by Johnson & Johnson and AstraZeneca. That laboratory was Canada's NRC. We were the only ones in the world to ever commercialize that vaccine. We got there first. And yet in 2020, that capacity has been unused, and today it's still unused.
And it's disappointing to hear. And with regards to our current task force, the secrecy around some of the decisions in the process, it seems to be undermining the public, there's no doubt. How does that translate to the scientific community, especially as we're looking to grow our own talent for the future out of this? I'm just wondering about that aspect because I know that the public is very concerned about the fact that there's no clear answers to even the contracts, for example, let alone the operations of the task force.
And this is just it. We are in the current predicament because two Canadian inferiorities have collided. We are inferior in science, and our government particularly is scientifically inferior, but we're also more secretive. And when you take the scientific backwardness combined with the secrecy that didn't allow outsiders to detect our missteps in 2020, you end up with the disaster we have in 2021.
And like going forward, like right now, our minivan plan is down for 3 weeks because we're dependent upon a small part. I'm finished. Thanks, Madam Chair. I see the card. I'm red flagged.
Thank you. We'll now go to our
Madame
next
la
round.
Présidente, juste avant, juste souligner que
Madam Chair, I would like to tell you that interpreters have problems. Sometimes we have problems hearing the interpreters. Thank you very much.
Get the microphone close to you so that we can make sure we have good translation. Thank you. We'll now go to MP Rempel Gardner. You have the floor for 5 minutes.
Thank you, Chair. To the CEO Provenance, it's my understanding that there are efficacy concerns with some of the adenovirus-based vaccines, such as Novavax and AstraZeneca. Is that efficacy against the variants? Is that your understanding?
That is what's been reported in the literature, yes.
And Mr. Sorensen, it's my understanding as well that mRNA-based vaccines are sort of becoming the gold standard, if you will, with early data with regard to efficacy against the variant. Is that correct?
Yes, again, if you're looking at reported data, the messenger RNA vaccines are responding to the variants the quickest.
In terms of Canada's ability to respond to variants with our existing vaccine purchase strategy, do you have confidence that we would be able to deal with efficacy concerns related to the variants as our current plan currently stands?
I believe you're going to. So the adenoviruses are not effective against the variants. They also have a challenge because of the vector delivery system. They have to adapt the actual design of the vaccine itself and the delivery system in order to accommodate. So they're going to be slow to respond.
But an mRNA technology could technically, to put it simply, turn on a dime faster than the adenovirus-based platform, correct?
The mRNA vaccines have the ability to be redosed. And so you do not have that same challenge with the viral vector deliveries.
With regard to the platform that you're building, would you be in a position, should you be able to scale up to potentially respond to variants in with boosters or redesigned, formula, if you will? I'm sorry, I'm an economist, not a virologist. Is that something you could do?
Absolutely.
So in terms of what I'm not understanding here is the problem with scale up. Maybe I'll back up. What do you need? What does the industry need in Canada? What do you need to develop enough capacity for us to be able to produce domestically on an mRNA platform within the medium term, let's say within a year?
We've already taken steps to accommodate for that. The capacity at the Northern RNA facility in Calgary partnered with the capacity of the Emergent Biosolutions facility in Manitoba. We have the ability to produce over 120 million doses.
Did the federal government reach out to you at all to offer assistance in this process?
No.
Did anyone take your call?
No.
Do you have any suspicion as to why that would be?
That's a question for the federal government.
Mm. Um, okay, so what do you need from us? We need your vaccines. What do you need?
Well, I've quite frankly, um, I've already got the discussions going on with the provinces that we're now filling orders. I would welcome support from the federal government and the NRC as we advance the clinical trial forward.
What about
And
special help from Health Canada with regard to certification?
we're not looking for any exceptions.
Okay.
We want to make sure that this is done properly. We just
What about
expect that
timelines though? Like just in terms of are you worried about like pedantry within the ministry or within the process, like roadblocks?
I don't believe that Health Canada functions that way. Our experience with the bureaucratic functions of the federal government, NGen, NRC, Health Canada have all been fantastic to date, and we have no reason to believe that that would not continue on a go-forward basis.
Good. What about resourcing?
It would be important as Health Canada continues to review additional technologies, not just provinces, that they have the resources at their disposal to be able to review those technologies on a rolling basis.
That's what I was getting at. So what kind of improvements would you recommend to the committee so we get to that point in a short period of time?
Quite frankly, that's beyond my expertise to advise.
Great. Is there anybody you could point us to the committee to bring on for that?
I'll give that some consideration and I'll provide some follow-up.
Thank you.
Thank you very much. Mr. Sorensen, if you do have some additional information you'd like to provide us, please send it to the clerk so that he could circulate it to the members. Thank you. With that, we now turn to MP Erskine Smith. You have the floor for 5 minutes.
Thanks, Madam Chair. I want to start with Mr. Gertz. I'm curious, there have been significant investments to build up domestic manufacturing capacity. We're not going to see, I don't think, that turn into capacity in the short term, but in the medium term, hopefully, including at your center. Do you have any other recommendations for what the government ought to be doing to make sure we are leaving no stone unturned and doing everything we can to ensure we have that capacity going forward?
Right. So I think there's a couple of recommendations. Number one, I think we need to invest into clinical trials for those candidates that are going forward right now. That includes our own candidate. We didn't really talk much about it. We're working on a protein vaccine here. We're at the same stage at the Providence. And it's critical for not only ours, but also for these other vaccine companies that were mentioned earlier, the 7, to have a good path forward in terms of clinical development. Phase 3 trials are very, very expensive. In the long term, though, I think what you are referring to is how can we better prepare for the future? And I think it's critical that the government considers funding into these organizations and to these centers that are specifically focused on emerging diseases and can address both emerging diseases affecting humans and animals. We talk a lot about, of course, about human disease today, but there is currently animal diseases that are circulating that represent a great threat to our livestock industries, including a disease called African swine fever. So we need to have almost like fire departments. We need to have these departments in the country that are able to tackle immediately emerging diseases. And that means immediately and not starting to hire people, train them, and so on. Just to give you an idea, it takes about 5 months, 4 to 5 months to get a person fully comfortable to work in a high containment lab with a potentially deadly virus. And so you don't want to, when a disease emerges, start to recruit new people. You have to have them ready and in place. And so part of our strategy for the country needs to be investing into the capacity, building centers that are specifically focused on emerging diseases, and then continue to fund them so that you have these people in place and not start looking for people or handing out money when a disease has emerged.
Can I ask, that all makes sense, and I would add we ought to think about pandemic risk as a matter of prevention outside of your area of expertise, also as it relates to food system transformation and climate action, and we should have a One Health approach. The experts seem to be universal in calling for a One Health approach, but governments haven't yet gotten there. But Mr. Gertz, when we look at the current crisis we are living through and the continued development, I suppose, of vaccine technology, you've talked about your own efforts. We have Mr. Sorensen talk about his efforts, and yet there are candidates already that are existing technology. We know that they work. why would we not focus our efforts on domestic manufacturing, licensing of existing the vaccines that have already been successful? Why reinvent the wheel here?
Because I think in the long term, that's the wrong strategy. I think in the long term, you want to build domestic capacity. You want to develop domestic expertise and manufacturing capacity. If you always rely on other countries or companies from other countries to sign a license with you, you will always be in the position of competing with other countries for the same technology. This time,
well, I don't mean always. I just mean right now in the crisis we're living through. But
I think that's what the government is doing right now, right?
Well, I suppose I mean in terms of building the supply here, but in relation to technology.
Well, there's a Novavax deal that was signed by the facility in Montreal. They're doing already what you just said, and as soon as our facility is up and running, we can do the same here.
Gotcha. And Mr. Attaran, I wonder about that, because I take that this was your point fundamentally, which is that if your main recommendation, from what I understand from your writing, and I think you're too pointed at times, if I'm being honest with you, but when it comes to, I took your recommendation to be licensing ought to have occurred with, say, AstraZeneca, and that we could have, through NRC, been building that out. I did put the question, though, to the Deputy Minister as it relates to the UK, and he, in fact, pointed to pre-existing investments. And I didn't know enough about this, so I went back and I looked. And in 2018, there was a £66 million investment, UK's first dedicated vaccine manufacturing innovation center, their first vaccine manufacturing and research center. And I wonder how, yes, we were behind the 8 ball in some ways, and the UK, we were maybe ahead of the UK pre-2018, but did the 2018 investment change that?
That 2018 investment in the UK is the sort of thing we need to do in Canada, but it is not yet operational. So it hasn't been a factor in this pandemic.
Well, I had read that it's not fully operational, but it's still pumping out millions of AstraZeneca doses.
No. Actually, the AstraZeneca doses are being arranged through a consortium out of Oxford Biomedica and Cobra Biologics, separate from that 2018 investment. Sir John Bell, who's the Regis Professor of Medicine at Oxford and the developer of the vaccine, spoke on this. He's Canadian, by the way, from Alberta. He spoke on this to Evan Solomon. I highly recommend you watch that interview.
Thank you very
much. What
much.
we should have done.
Thank you, Professor Attaran. Just a gentle reminder to members and witnesses, if you could please make sure not to cut each other off, because the translators have trouble keeping up and hearing the what you're trying to say if you're talking over each other. With that, I will now go to Monsieur Lemire. Vous avez la parole pour 5 minutes.
Mr. Lemire, you have 5 minutes. Oh, it's my turn? No, it's 2 minutes 30 to be specific. Unfortunately. Yes, I would like to go on with Mr. Lemire. Could you explain us the importance of generously funding research funds for basic research to develop a quality ecosystem that will invest in the new pharmaceutical multinationals? Yes, thank you, Mr. Lemire. Excellent question. We previously discussed with Mr. Lection, who said that investments in CHR Canada are of the order of $1 billion in Canada. If we compare with the States, per capita, we're 4 less funded here for research. Same thing for basic research and engineering research. We saw investment that reached a ceiling in Canada in terms of investment in basic research. While there are more and more researchers in Canada who are attracted by working conditions that are very good, and also access to infrastructures by the research chairs in Canada. So the consequence is that we have more and more researchers and less funds. So the efforts dropped considerably in this regard. So to keep our good brains, our good researchers, we have to continue generously invest in order to be able to catch up the delay we had over the last 20 years. Yes, it's important to make more investments to protect ourselves against future pandemics. So could you tell us more in detail your proposal of accelerator of vaccine development? it would be a public structure and not private structure. We would not depend on, as someone said previously, on a company who could have the last word and close its doors. It would be so it would be we should be able to advance our industrial capacity, and funding obviously would be very necessary in such a structure. With the importance of diversify the type of technologies that would be involved. Thank you very much.
You have the floor for 2.5 minutes.
Thank you, Madam Chair. And I'm going to return to Mr. Lexon with regards to your recommendations and the current construct of the task force. Are you confident that we could see our way through, I guess, the future with the current task force and structure it has, or do we need some revamping there with regards to getting to a position of less dependency in our country?
So let me refer you to recommendations from the United States from what used to be called the Institute of Medicine. Now it's the National Academy of Medicine. And they came up with recommendations with regard to constructing what are called clinical practice guidelines. These are sets of recommendations for doctors as to how to diagnose and treat conditions. And two of the recommendations are relevant to the task force that we have. And the first one is that the chairs of of any clinical development guideline committee should not have any conflicts of interest. Both of the chairs of the vaccine task force have significant conflicts of interest, and I think we need to worry about that. Secondly, they said that at least half of the members of any committee should not have conflicts, and I think that the current task force is around half of the members having conflicts. So again, we are not complying with those guidelines. Those are American guidelines, but they're recognized in many countries. So I think that if we want continuing with a task force is a good idea, but I think we need to restructure the task force to remove the conflicts of interest. It will create trust in the recommendations that they're making.
And quickly, Mr. Attaran, the task force, a similar question to yourself, because we have to look towards the future here. Any comments about improving the task force or a revamp an entire model?
Disband it and start over. I mean, it clearly made fundamental mistakes. We're living with them right now. Disband it, reappoint it, make everything transparent, the meeting minutes, the agendas of the meetings, the conflicts of interest. If I publish a paper in the lowest grade medical journal, I have to disclose all my conflicts of interest. These people are making the highest stakes decisions in the country right now. They haven't fully disclosed their conflicts of interest. Something is wrong there.
Thank you very much. Our next round of questions goes to MP Dreeshen. You have the floor for 5 minutes.
Well, thank you very much, Madam Chair. And certainly, I wish we could have had these witnesses here prior to our meetings with the ministers. I think that would have certainly helped us focus our discussions. But nevertheless, and I was going to ask about the vaccine task force, but I think the comments that Mr. Attaran has just mentioned, probably having those on the record is probably good enough. And I suppose my next question will be to Mr. Attaran. I know that we recently heard that the member from Thunder Bay Rainy River, who is a medical doctor, sent a message to his colleagues that indicated that this Liberal government's pandemic response has been so secretive and it's hard to have faith and it's difficult to accept reassurances that Canada is doing all the right things. My question has to do with the secrecy. It has to do with the reason why Canada can't seem to find its way to discuss contract information with suppliers, yet other countries can. And you also mentioned at the end of your presentation that you're not confident that good ideas are even being heard by the government, and that's critical for our security. I was wondering if you could expand upon on those comments, please.
Well, thanks for the question. Look, the fundamental failure of this government is that it has the wrong people in charge. I mentioned in my testimony the folly of putting a vaccine strategy in the hands of the industry minister and the procurement minister, not the health ministry where the scientists are. But across the board, this government doesn't utilize the people it's got well. I'll just point to some stars. Kirsty Duncan on the Liberal side of the House, she did a PhD on pandemics. She's not involved. It's absurd. Ms. Jacek, you were a public health officer for many years. I don't see you directing, and I kind of wish you were from among
Professor
the Liberal
Attaran, I ask
right?
that you put your questions through the chair, please.
Sure. It wasn't a question, it was a comment. But anyway, and your point on secrecy is very well taken. I mean, the United States, Brazil, the 27 European Union countries have to some extent disclosed their contracts with vaccine manufacturers. Canada hasn't. Now, one of those, the one with Moderna, will eventually become public because of US disclosure to the Security and Exchange Commission. But it's absurd that we're relying on American law and American regulatory mechanisms to get us transparency about what's happening in Canada. It's very simple. If you take high stakes decisions secretly behind closed doors, without peer review, without peers in the field able to view what's happening, offer constructive criticism, you end up in a dead end after bad decisions are made. Science turns on peer review. That is its lifeblood. And in this life-saving moment or not, peers are not entitled to review what the government is doing. It is shocking, it is negligent, and it is the result of our failure in very considerable part.
Thank you. I'd like to talk now to both Mr. Sorensen and Mr. Geertz, because of course we're at this situation where the provinces are saying, let us get engaged here. Of course, if they don't know what is in a contract between the federal government and the various manufacturers, it makes it very difficult for your organizations as well to get there. And I suppose perhaps, Mr. Geertz, I probably know a lot more veterinarians than I do doctors. So I'm just curious if you could talk somewhat about the significance of what the research that you've had, African swine fever, other types of issues, how quickly you've been able to gear up to be able to handle those other types of clinical issues as well.
Yeah, thanks for the question. So we've been working on animal diseases for 45 years, and we made a number of coronavirus vaccines that were licensed and commercialized for other species. And when SARS-1 came, we were part of the Canadian Accelerated Vaccine Initiative. At the time, we were just doing research on MERS before the pandemic hit. So we have a lot of expertise in working on these viruses. And as you know, they're affecting animals and humans. I mean, we live in a One Health world. And so here we have a lot of expertise on working with these. And that was really the reason why our vaccine went forward so quickly.
Thank you. And perhaps, Mr. Sorensen, you've mentioned Providence has the ability to scale up manufacturing. But again, you're kind of looking at arrangements that you would have with the provinces. Is there any hope of cooperation? Okay, sorry, Madam Chair.
My apologies. You've gone a little over time.
Okay, I didn't see the yellow card. So
hopefully at the next round we'll be able to get that answer.
Okay.
We now go to MP Jacek. You have the floor for 5 minutes.
Thank you, Madam Chair, and thank you to all the witnesses. This is certainly a stimulating committee meeting. My first question is for Mr. Sorensen. Mr. Sorensen, could you detail to us the funds that you've actually received from the federal government?
Yes. As of December 31st, 2020, Providence had received $878,182 from NRC and $350,000 from NGen. Thus far in 2021, we have received an additional $907,000 648 from the NRC. All told, provinces received just over $2 million cumulative as of today from the federal government.
And you didn't receive any funding from the Strategic Innovation Fund?
No.
I have some information that apparently you did receive some 4.7 million at some point.
That is a commitment through the National Research Council. And I just articulated how much we've received of that commitment to date.
But you were committed a sum of some 4.7 million.
Through the National Research Council, correct, yes.
Yes. And following that commitment, what sort of data have you been required to submit to the National Research Council?
We provide the National Research Council regular updates on our progress with regards to phase 1 clinical trial. We provided them the full package that was also submitted to Health Canada, in which we received our authorization to proceed, and we provided them full access to all of our preclinical data.
And as you progress through the various clinical trials, potentially or whatever, you will be submitting data as it comes in?
Yes.
And would you anticipate then further funding from the federal government?
It is our intention to proceed with the National Research Council and with the Strategic Innovation Fund to invite them to participate in sponsorship of phase 2 and phase 3 clinical trials. However, that is not necessary for us to proceed.
It seems like it's a responsible process to me. In other words, you submit data and then there's a further commitment of funding. And it seems to be decision-making based on science, which I'm sure is music to Professor Ataran's ears. I would like now to turn to Dr. Lexgen. Dr. Lexgen, you mentioned compulsory licensing. Could you please explain exactly what you mean by that and how it would work?
Sure. First of all, let me point out that back in the early days of the pandemic, Parliament passed Bill C-13, which did allow compulsory licensing for a period of time, but that expired at the end of September of 2020. So compulsory licensing, in essence, means that the government can issue a license to another company to make a product which is still under patent. So in that way, you can expand the production capability, and you also perhaps can get competition in terms of price.
Thank you for that. So, Mr. Casey, perhaps you could give us your opinion on compulsory licensing. I presume this has been a discussion with the many members of your organization.
Well, it has. I mean, I think Canada has recognized it's in a globally competitive industry, and so you have to adopt policies that are actually going to allow the industry to compete globally and to also participate here. I think it's part of why we've seen a little bit of the industry disappear in Canada. I think we have adopted pricing policies that make it somewhat hospitable for a lot of those companies to be here. And as I think about going forward, we have to sort of figure out how to get through the immediate period ahead with some of the challenges that are coming with the variants and the mutations. But as we sort of think, again, as I said earlier, looking ahead, I think the large multinationals are going to be an absolutely critical part of partnering with the companies like Vito Entervac, Medicago, the other ones that are Canadian entities that are here in this country. That partnership is going to be absolutely critical going forward.
And back to Dr. Lexgen, I just want to confirm with you that when you were calling for domestic, publicly owned manufacturing facilities, that the plant being built in Montreal, the biologic manufacturing plant being built by NRC, would this fit the bill for you?
Very quickly.
Sorry, I don't have enough details to say whether or not it would fit the bill.
Thank you very much. We will now start our third round of questions. With that, I turn to MP Baldinelli. Welcome to INDU, and you have the floor for 5 minutes.
Thank you, Chair, and thank you to the witnesses for appearing today. It's my pleasure to be on the committee in my first day. I'd like to pose a question quickly to Mr. Sorensen, if I could. I mean, you've already announced plans to produce 50 million doses of your vaccine by the end of 2021, and you just mentioned you have the ability to produce up to 120 million doses. If you had received significant federal support earlier, is it reasonable to assume that you would have been able to produce enough doses for most Canadians even earlier in 2021?
Thank you for the question. So we have the capacity with the Northern RNA and the Emergent Biosolutions facilities beginning in July to produce 50,000 vials a day. Each vial contains 10 doses of the vaccine, so that is 500,000 doses per day beginning in July. So our total capacity that we could produce in 2021 would be 50 million doses. We are now receiving orders from provinces. We are going to set that production limit, and we are going to produce what has been ordered. On a full year basis, we have the ability to produce, if you include necessary downtime on the facilities, up to 120 million doses on an annual basis with the current infrastructure.
Now, just following up on a question that was asked by one of my colleagues, and the amount of money that was provided in terms of federal support to date, is it the provincial funding in terms of contracts that is taking you through those stage 2 clinical trials and those stage 3 clinical trials? Because you indicated you no longer need federal support. Is it because of the provincial funding?
We would welcome the federal support, but at the point of being able to do the production and have the offtake agreements with the provinces, we now have the ability to go to the capital markets and to raise sufficient capital funds to carry forward our plan, regardless of whether or not we have support from the federal government.
And how much have the provinces ordered?
That will be disclosed in the coming 10 days.
Okay, thank you for that. I'd like to follow up, if I could, with Mr. Gertz and a question to him. And you indicated your vaccine production facility is slated to be operational in 2022, if that's correct. Is there anything that could have been done to speed up this process? Is there more funding, an expedited certification process that could be used to support?
Yeah, so more funding at the moment wouldn't really have made much of a difference. What we're hoping for is an expediting certification and commissioning process. And so that's something we're working on right now with the regulators to recognize that we are in a pandemic and that it's important to, without compromising on the safety, to do this as quickly as possible.
Now, we've negotiated the right to manufacture vaccines like, if we had negotiated the right to manufacture vaccines like AstraZeneca in our contracts with them, would you have been able to manufacture them in your facilities?
Yes, we would have been able to make all vaccine technologies with the exception of RNA or DNA vaccines.
And would it have taken you and your company an inordinate amount of time to scale up to do so?
So just to clarify, we're a university, we're a public research organization here, but it always takes some time to transfer the technology and adapt to a new facility. But as we heard earlier, our facility is using what is called single use. And so essentially what that means is make it very simple. You have very large plastic bags that you put in these stainless steel bioreactors and then allow you to make a certain vaccine product, take the bag out, harvest the vaccine. In the meantime, you can put a new bag in for a different kind of vaccine. So our facility is designed to make different vaccine technologies in the same facility, both for human and animals.
Thank you for that. And a quick question to Mr. Casey. It says, as the government has recently updated the Pfizer labels to require 6 doses to be extracted. I mean, the problem is it requires specialized syringes that are in short supply. So does Canada have the capacity to produce these syringes domestically?
Yeah, it's beyond my expertise. I do think it points to the bigger question, though, in terms of fill and finish distribution. Getting all those logistics in order is going to be absolutely critical. We can have the science, we can have the technology, we can develop the vaccines, but the ability to get it out and into arms is always going to be a fairly significant challenge if you're trying to put them into 8 billion arms around the world.
Thank you very much, Mr. Casey. We now go to MP Johari. You have the floor for 5 minutes.
Thank you, Madam Chair, and thank you to all the witnesses. It's quite clear that we are all passionate about serving the Canadians and quite proud to be Canadian. Let me start with Providence and Mr. Sorensen. Mr. Sorensen, in your opening testimony, opening remarks, you talked about the fact that you're in a position to be able to design the vaccine in 4 weeks. Can you give us a timeline as when that design was completed?
The design was completed in March of 2020.
So in March of 2020. And I also understand, based on the comments you made, that the capacity, you do have the capacity, or in early March, you had the capacity to be able to develop this vaccine, correct?
That is correct. We had a GMP facility at Sunnybrook Research Institute.
Great. And so what can you help us understand between March that you developed, let's say mid-March that you developed that vaccine, to to December 4th of 2020, where you submitted your clinical application? What transpired in that time, and was there anything the government of Canada could have done to be able to expedite that? Because you would be a prime candidate, having developed the vaccine in less than 4 weeks, and then having the capacity to be part of that 76 companies or organizations that were evaluated. Can you help us understand what happened during those times?
Certainly. So in the second half of April, we were formally invited by the Strategic Innovation Fund to make application for their review. We were told at that time that we would receive that of all of the applications, there would be a short list, and that the short list would be contacted within a week, 2 weeks tops. And then they would move forward with those that were shortlisted. We followed up in a week, and we were told that they were still receiving applications. We followed up in another week. We were told that we would need to wait another 2 weeks. We followed up in 2 weeks, and we were told that we needed to wait because they were structuring the vaccine task force, and they needed to have the guidance of the vaccine task force before they could begin their work. We kept waiting throughout the entire summer.
From your thank you for that. But from the point of development of the vaccine, you had a design, okay, and what you're trying to do, what would be the next step in that? You have a formula. I believe you manufacture a batch, and then you start doing clinical trial or animal trial. That's the path that I'm really interested to get an idea of what you went through.
Certainly. So we designed the vaccine. We took that vaccine into animal trials where we tested safety and we tested efficacy. We did 2 efficacy trials, one in mice, one in hamsters. We did a number of safety trials.
Can you help us with the timing on that?
Certainly. So the safety trials we did an initial safety trial with the University of Toronto, and that would have been conducted in April. We published that data, I believe it was in June, and we did additional follow-up safety trials that summer with Charles River Laboratories in Quebec. And then we also did, in conjunction with the University of Toronto, our efficacy trials in over the summer in mice and in hamsters. The question that you asked is, could we have done it quicker with support? Yes, we could have done it quicker with support. One of the biggest challenges that we faced was that we were in lockdown and we had limited access to our own facilities because of the lockdown criteria, and we could not be designated as essential services.
Okay, so had it not been in a lockdown and you had access,
to the facility, you could have shortened your, let's say, test cycle. But when it opened up, you were approved. You made this application on December 4th, approved on 23rd, and then your first trial was on January 26th. So can you, in the last 15 seconds that I have, can you give me your perspective of government response in, at least Health Canada's response in being able to get you where you need to be?
Health Canada has responded very, very quickly with regards to reviewing and giving us the authorization to proceed with our clinical trial.
Thank you.
Thank you very much. We now turn to Député Lemire. Vous avez 2 minutes et demie.
Mr. Lemire, you have the floor. Thank you, Madam Chair. My question is for Mr. Attaran. I was very interested by the issue of the lack of transparency and conflict of interest. Has he heard of the comparative list in The Economist? Canada is not in the 37 countries that have vaccination in 2021. They'll only be there in 2022. Do you think that most Canadians will be vaccinated by September 2021, like the Prime Minister and the ministers have been saying for the last 2 weeks? I couldn't tell you because there is no transparency. The Prime Minister assures us that we will be. But who knows? We cannot tell because if we can't look at the contract, if we don't know what the plans are, how can we know? I agree entirely with you, Mr. Attaran. The Canadian strategy is probably much more expensive than any other countries. Do you think that a vaccine that is paid for at the last trimester of 2020 will be much more expensive than a vaccine that we'll get next summer?
We shouldn't really be worried about this. What I'm worried about is, even right now, the government is failing awfully at advancing manufacturing plans. We are doing it in the slowest possible way we could. And what happens if in the next 12 months, evolution gives us a new variant that is highly resistant to existing vaccines? Then we are cooked. So I want to see vaccine manufacturing in this country moving at a British speed so that by summer, like the British, we have manufacturing underway. This idea of letting the manufacturing come at the end of the year or next year is simply asking to put our lives at risk if there is a nasty surprise given to us by evolution.
If you could give a grade of 1 to 10 for the Canadian strategy since the beginning of the pandemic, what would it be?
Do that, huh? Look, D. It's close to a failure.
Merci beaucoup.
Thank you.
Questions goes to MP Massé. You have the floor for 2.5 minutes.
Thank you, Madam Chair. And I had another question. I'm going to go back to Mr. Attaran with regards to capacity of that. I mean, here's the reality, though, is the vaccine promise, it's starting to roll in there with childcare, pharmacare, electoral reform, Bill C-51, climate change, fossil fuel subsidies, a whole series of things that have been promised and never acted upon. But this one's really dangerous in particular. The other ones are equally difficult to deal with as well, too. But this one's really bad. I do want to know, though, is if we are able to ramp up and catch up with what's going on, do we have the infrastructure for the administration of the vaccine? Do we have the physical capacity being put in place right now by the task force to make sure that if we are going to play catch up, we can do so with the actual proper administration of the vaccine to our population?
Before I answer that, I'll comment on what you just said. There's something different about a pandemic and vaccination from all the other challenges you listed. A government's highest moral priority is protecting the life of its citizens. There is nothing above that. And if a government can't do that effectively, convincingly, with transparency, it is not fit. And as I see it right now, we do not have the transparency to answer your question on the implementational side of what will happen when vaccines come. You know, in other countries, mass vaccination campaigns are the norm. I have not heard plans in Canada for the development of mass vaccination campaigns, and there need to be. You know, I'll give you an example. Bangladesh vaccinated over 50 million children in 3 weeks. Bangladesh, one of the poorest countries on earth. Why am I not hearing a Canadian plan to vaccinate millions in a few weeks? Why isn't that transparent? Either it doesn't exist or it's hidden. And either way, I'm not given to good sleep at night.
So I guess the question is going to be for ourselves, if we finally actually do get the vaccines and we need foreign help to do so, we're going to need foreign help to administer them to our own citizens as well. I mean, this is what it's coming to. I really worry about the fact that there doesn't seem to be a plan. You can check out what Australia is doing, you can check out what other places are going on. Across from me in Detroit, Michigan, they're doing them right now through the drugstores. That's 2 kilometers from where I am right now. We're at drugstores, chain stores, grocery stores, hospitals, they have massive clinics. This is how real it is. I know Canadians are flying to Alaska and Florida, but right now you could get in your car and be over a place and get vaccinated if you could cross the border in less than, I guess, 10 minutes. That's really what it would take to get across there. It's very it's very difficult for people to accept. Thank you, Madam Chair.
Thank you, MP Massey. Our next round of questions goes to MP Rempel-Garner. You have the floor for 5 minutes.
Thank you, Chair. All right. Look, this has been a disaster. We are not in a great situation. I'm concerned about how we move forward as a country. There will be time for finger pointing and partisan politics later. We need to move forward and we need a plan. So what I've heard from today from witnesses, I've just been trying to summarize some recommendations on how we can move forward. I'd like to put them out there, and I'd just like the witnesses to say general agreement or disagreement with them. So if what we're managing to is to build enough domestic manufacturing capacity for, I'm going to say specifically mRNA vaccines by the end of 2021, this is what I've heard to date. We need to disband the vaccine task force and reconstruct it with people who do not have conflict of interest, that is personal or commercial interest in any specific vaccine. We need to ensure that the certification process for domestic manufacturing capacity doesn't sacrifice scientific review quality, but doesn't happen slowly, that it happens quickly, and that certification process is adequately resourced. We would need some administrative oversight of that immediately. We probably need some sort of a special cabinet committee or some sort of direct link into the cabinet process for manufacturers who are undergoing this process so that they're not experiencing the type of political inertia that Mr. Sorensen's company did. We need to structure our manufacturing capacity not just around one type of vaccine platform, and we should be structuring it around the capacity, clinically proven capacity to respond to variants in a quick period of time. We should be undertaking a expedited right now review process to eliminate red tape, unnecessary red tape around increasing production capacity, as well as review of Canadian made products, and institute a fund to expedite infrastructure and certification with a quick yes or a no process for eligible Canadian manufacturing capacity. Does that sound right? And I will start with Mr. Sorensen.
Yes, I agree with those recommendations.
Thank you. Mr. Lection.
Yes, with the exception that if we're going to expedite the approval of vaccines, we need to also ensure that post-market testing is done to ensure at least short-term safety.
Absolutely. And I want to be very clear. I don't think we should sacrifice safety at all or the review process. I just think that we can probably have our cake and eat it too and do it quickly and safely. Mr. Lamar.
Oui, je suis d'accord avec toutes vos suggestions.
Yes, I agree with everything you've just said.
Mr. Casey.
Well, I seem to be alone. I think the task force was strong. I think they did great work. I'm not convinced that we need to amend it. I don't think the pool is deep and wide enough in Canada to avoid some of what are perceived to be conflicts of interest. But
surely we could bring international experts in.
Absolutely.
Right?
So can we add more? Absolutely. And I think,
Great.
but I think your focus is entirely correct. We've got to start to look forward in the immediate future with the variants and the mutations, and then prepare for the longer term.
Mr. Alvaran.
Yep.
I love your plan. 2 changes. 1, do not bet on mRNA vaccines
Yes.
only. Danger,
Yes.
danger, danger. And
Yes.
I, by the way, I
But
personally
we
don't
shouldn't be betting just on adenovirus either, right? We need to have
both at all
Yeah.
3 protein subunit as well.
Absolutely.
I do not think there's a chance. Providence has been through a bad experience. I do not think there's a snowball's chance I'll have a vaccine commercialized by the end of the year. That's a separate discussion. The other thing I would change is why must we review everything for safety ourselves at Health Canada? You know, the European Union has one regulatory agency for 27 countries. I would be fine almost automatically approving any vaccine that the European Union does or the USA does.
So,
Because
so
the
sub
FDA is
amendment
European-
to what I was suggesting was also look at ways in the certification process to import data from other jurisdictions.
And that's a great
Okay.
idea. I'd go a step further. Just grant automatic recognition to what the Europeans approve and register or what the Americans approve and register. They are technically competent, more competent than Health Canada. There's no need to reinvent the wheel. If we're trying to save time, just recognize their approval as good enough.
Thank you. To anyone else that's here, did I miss anything? Like, I'm so tired of us sitting here finger pointing. We need a way forward. Is there anything else that you need to do?
So Fokagetsia, 2 comments. I would also not only recommend and focus on RNA vaccines. We see a huge amount of vaccine hesitancy right now. 40% of Canadians do not want to get vaccinated right now. And that is because everything is focusing in your strategy on a new vaccine.
So education of vaccines as well.
That's right.
The Canadian
That's right.
public.
So we need to have multiple technologies, better education, and we also need to have, which you didn't have, research capacity. You can't just start vaccinating or manufacturing a vaccine without understanding the disease. And so that research capacity, at the moment, we're relying on other countries. We need to have that in Canada too.
Thank you very much. And our next round of questions will go to MP Labropoulos. You have the floor.
Thank you, Madam Chair, and I'd like to begin by thanking all of the witnesses for being here today to answer our questions. I think, Mr. Gertz, you hit the nail on the head with regards to vaccine hesitancy. I think we speak a lot about production and about procurement, but we are not talking enough about the people that refuse to get a vaccine and that will continue to, spread the virus as we go on. So education is key there. With regards to what Mr. Attaran said, I think I agree. We can't bet on only one type of vaccine and hope that it is more effective than anything else, considering we're so early on in the game. And so, Mr. Sorensen, I know that you recently wrote to the federal government for extra support. I believe 150 million was what the ask was in order to help the vaccine production and in order to quicken things up. But would you not agree that with regards to such things and with regards to the fact that we have to procure enough vaccines to get us through the current wave that we're in, and we also have to invest in research, that it would be unwise of us to just give a one lump sum in one shot? I know that we've already invested 4.7 million, as my colleague Ms. Jasic mentioned, and I know that our government also, through the NGen supercluster to scale up manufacturing capacity, gave or committed to another 5 million. What are your thoughts on this?
So we were not seeking a $150 million grant. We were seeking a $150 million deposit so that we could engage our manufacturing plan and purchase the required raw materials in order to make 50 million doses of vaccines in 2021. The Canadian government chose not to respond to that, and so we are now doing that with the provinces.
I believe you wrote to them on February 5th, 2021. Is that not correct?
That is correct.
So you haven't heard back yet?
I received a phone call from Minister Champagne on Saturday, and that was the first contact that we've received. And we did not discuss that particular letter. We discussed other infrastructure dialogue.
Okay. Thank you very much. And with regards to a national vaccination campaign, which Mr. Attaran had also made reference to, and so I guess my question is going to you. Currently, provinces and territories are in charge of managing their own vaccination rollout, as we know. However, some Canadians are preoccupied about this, worried about some of the decisions being made by certain provinces. How do you think that the federal government can work with the provinces and territories, considering that it's their jurisdiction, to help with this type of a national vaccine rollout?
Okay, first of all, your question has an incorrect premise. Health is a shared jurisdiction under the Constitution, both federal and provincial. So continued sedulous attention to the myth that it's provincial only, simply, you're getting off on the wrong foot as a government with that. I think what we should be doing is using a campaign style model to administer the vaccines that will come and that are not quite as thermo instable as the mRNA ones. That will allow us to take vaccines wherever you can take a cooler of beer. That's what you can do with the adenovirus ones. It's what you can do with the Moderna one to some extent too, the Novavax. When we get to that point, we should be having vaccination clinics across this country in schools, rec centers, churches, mosques, what have you, city halls. And those should be organized with a very strong federal and in cooperation with the provinces. I would recommend working with the Canadian Red Cross on that. It's a national organization with provincial presence, and it has experience. The Red Cross globally has experience in hundreds, perhaps several hundred vaccine campaigns around the world that have been highly successful. Where are they on this? Why aren't they being used? Why can't we use them to coordinate? And by the way, also the Canadian forces too. Vaccine campaign administration. That's what we need.
All right, thank you very much. No further questions.
Thank you very much. So that wraps up our time for today. I'd like to thank the witnesses for being here. I found today's testimony very helpful and appreciate your time. With that, just remind the members that we will have the vaccine task force with us this Thursday. So I'm sure some of the questions that came up today, we can make sure we can use them on Thursday. With that, I'd like to thank everyone again for their time. Merci beaucoup au service de traduction.
Thank you very much to the interpreters and the IT system. Thank you to the analysts and the clerk.